Good morning, Dr. Collin.
Good morning, how are you?
I'm fine, how are you?
I'm very well, thank you.
Oliotia, Sebo.
Bolongi.
Yes. Now, Dr. Collin, you're coming to the end of your stay in Uganda, your attachment in Jinja Hospital. It's been quite a while, over 5 months in Uganda. Can you please talk briefly about your experience in Jinja Hospital?
Yeah, of course. So, as you say, it's been about five and a half months that we've been in the Paediatric department here in Jinja. And although we'd spent weeks beforehand learning lots of things about Ugandan healthcare and about how to manage patients in a resource-limited setting, it was still quite a shock when we originally came here, getting used to it. It's obviously very different from the hospitals we practice in the UK. And there is a lot less support, there's a lot less available, that's in terms of medicines, drugs, oxygen, the bedding. It's an extremely crowded place when compared to hospitals back home. And all of that took some getting used to, but the staff here were extremely welcoming, really opened their arms and invited us in and made us feel part of their team. And for the first few weeks, well, probably the first couple of months, it was us that were doing all of the learning. So we were having to learn about how healthcare works in this kind of environment and about the different conditions that we really don't see. Things like malaria, tuberculosis, HIV, all things that are much rarer in the UK but are very commonly seen here in Jinja. And so it took us a while to learn how things work and about what we should be doing. And we were sort of supported in that by all of the nursing staff, the doctors, the clinical officers, and that was certainly fantastic. And then after that, hopefully we've managed to contribute something towards Jinja and try and help a little bit. But we've certainly had an amazing time while we've been here.
Okay, thank you. What are your recommendations to the improvement of paediatric care in Jinja Hospital?
I think the two basic things are to keep it simple and to make sure it's sustainable. So often people think about the big projects that they could do or the big gestures that they could give, but those are often, one, very hard to implement, and two, often don't last after that initial investment has been put in. So the things that I would say are to look at what is causing severe morbidity and mortality in Jinja. And in the patients that I've seen here in the paediatric department, that's malaria and pneumonia. And then you look at the things that you need to treat them, and they're all actually quite readily available. So anti-malarials, antibiotics, oxygen, and then blood. To make all four of those things available all the time, every time, and that includes things like having cannulas available and blood giving sets, and being able to give high amounts of oxygen. So at the moment you can only give 5 litres from the oxygen concentrators, but actually often what children need is more than that, 10 to 15 litres. So I would just say give oxygen, make sure oxygen's available, make sure blood is always available, including cannulas and giving sets, and then make sure anti-malarials and antibiotics available. And doing those simple things, I actually think will make the biggest difference.
Thank you. And how do you think volunteers out there from the UK, in the United States or elsewhere in the world should prepare to better adapt to the environment and work in this country?
So I think speaking to people, so watching these videos perhaps, talking to us or getting in contact with us. So if you did want to get in contact, my email address is cjg14@hotmail.co.uk. There's also a blog which I've written, which is cjg14@blogspot.com. All of that has information written in it, specifically about Uganda and about Jinja Regional Referral Hospital. Do some reading on the country itself, just understand, it doesn't matter if you're coming to Uganda, Kenya, anywhere, or any country you ever want to work in. Make sure you know a little bit about the country and its culture so that you're able to understand things before you come. And then, as much as you will try and prepare yourself before you get here, understand that when you get here it will still be very different from what you've prepared for, and be prepared to take your time. Do not think when you first come here that you are going to be able to make sudden big changes. You have not worked in this system or this environment. You need to learn the system and the environment before you try and make any changes. So make sure you do your learning first, and then you can think about what you can change and implement. And once again, do not try and do big things fast. Just do the small, simple things, because they are often what will make the biggest difference.
Thank you very much.
Thank you.
And good luck on your endeavors back in the United Kingdom.